start tonight's webinar. And greetings to you from wherever you are. And we look forward to having this discussion with everybody. So we're going to start just very shortly here. As we're getting ramped up here, in the Q&A box, you'll be able to type in where you are watching us from. So you'll see the Q&A. I've enabled questions on this webinar. So please just type in your name and where you are joining us from, and we'll go ahead and get started. All right, good evening and welcome everybody. My name is Dr. Jordan Metzl, and welcome to our webinar called Running Medicine, a weekly look inside our new world. Now tonight, we are joined on this webinar by three incredible guests addressing the topic, running during a pandemic, what's the best advice? And I wish we didn't have to have a webinar on this topic. I wish we were talking about running in Central Park and getting ready to meet in a group like I'm going to show you in a second. But the truth of the matter is that this really is a serious situation. And as a running community, we want to really be able to address these issues for you. I'm joined tonight by Jeff Dengate, the runner-in-chief at Runner's World Magazine and Runner's World, Polly DeMille, the director of the Tisch Performance Center at Hospital for Special Surgery, and Brett Torresdal, the research director at the Hospital for Special Surgery Primary Sports Medicine Service. So with that, I'm going to show you our panelists, and I'm going to unmute Jeff Dengate. And I'm going to, first of all, if you're new to Zoom, you have a couple different options in watching this webinar. First of all, you can swipe right or swipe left on your screen, and you can, by that process, see just the speaker, or you can see all the panelists' faces at once. And then there's also an opportunity to ask questions at the bottom. We've had about 17, 18 people tell us where they're watching from New York, from California, from Oakland. So just a great crew from Mexico. Welcome from Astoria. Hi, Sandy from New Jersey. So we really have a nice Pennsylvania, just a nice crew from all over the place here. All right, so tonight's webinar, the topic is running during a pandemic. What's the best advice? And as the running community, we love to run. It's our favorite thing to do, and we're used to running through everything. So as runners, we're used to running in the snow, running in the rain, running through everything. And this is, in my running career, one of the first times I can remember that the idea of being afraid to run is something which is really new to me and to everybody in my community. And I think these people are going to say the same. And on the medical side, we're trying to give the best advice for everybody in terms of what's healthy, what's the right recommendations. And so tonight's panel is going to be an attempt to give you the best updated information as runners. And in New York City, our running community is one of the best in the world, one of the best I've ever seen. Very cohesive group, and there's not a ton of places to run. So Central Park is a place everybody meets, and you see everybody, and that's usually terrific. And now we're in a place where we can see them, but we can only see them from afar, and we don't know how long that's going to last. We don't know what it means for all of us, and it's very frightening. So want to really try and get to the bottom of some of these issues, or at least discuss these with you. And I'm first going to start with Jeff Dengate. Jeff, as many know, is the runner-in-chief at Runner's World and a longtime friend and longtime runner. Jeff, thanks so much for joining us tonight.
Yeah, thanks for having me.
All right, so Jeff, you have your ear to the pavement and have for a long time. And when I shot you a note talking about starting this webinar series, examining all the different aspects of running, and wanted to kind of get your take on what's happening, you are one of the first people I reached out to because I think you have your ear to what people are saying, both in the New York community where you live and run, and also nationally where runners are kind of trying to grasp what's happening in New York, because I think we're at the beginning of this. Many other communities will deal with this going forward. So what are you hearing?
And even globally, Jordan, we hear from runners all around the world. I heard from runners in Spain and Peru when they got locked down and said, we can't even go outside. So that's kind of the fear that a lot of us have been working under, is we have these new stay-at-home rules, and what do they mean? Can I actually go outside? And every local government is sort of implementing them a little bit differently. So in Chicago, for example, the mayor shut down the waterfront pathway along Lake Michigan because it was just too crowded. There were just too many people running along there. Like Central Park, that could be a place that just gets shut down, or the Hudson River pathway. get shut down because there's just going to be too much congestion, too many people congregating to those. The Appalachian Trail in Pennsylvania has been shut down in sections. State parks are closed because it is okay for us to go outside and run if we're healthy and we're not showing any symptoms and we're totally alone by ourselves, keeping our social distance. It's okay. It's good to actually get out and move and exercise, as we're going to hear those reasons as well. But the problem is, a lot of people, that's the only kind of movement they can get now. Their gyms are closed. Their CrossFit boxes are closed. They can't pick up hoops. So a lot of people all of a sudden remember that they had a pair of running shoes and they want to see, all right, I need to move. I need to exercise. So they're coming out and they're running again, which is good, but it also makes it challenging. I think one of the biggest things for us runners is finding those places we can go to be safe. I think for me, I feel more like, I don't want to be around people. I don't want to get it, but I also don't want to crowd people. And the sidewalks where I live are pretty narrow. They're not 6 feet wide. So, I end up finding that I'm running out in out in the bike lane or out in the road with cars, which thankfully there are fewer cars on the road because nobody has to go to work. But it's stressful. It's tough.
Yeah, for sure. As you can see on the viewers right, your left side of the screen, I put up a poll to kind of start this. And the questions I asked are you running outside? And it looks like almost 90% of our answers are yes, I'm running outside. How much are you running normal, more than normal, or less than normal? And it looks kind of evenly split. And I need running now more than I did last month. And that looks to be almost 90% of the people. And I'm using a mask when I run. And that looks about 7% of the people are using a mask and the rest are not. And so I think thanks for answering those questions, everybody. I wanted to put those up just to kind of frame the next question to you, Jeff, which was your coverage and how you're kind of changing your approach at Runner's World, because you're used to talking about a whole host of things which are very different than I'm sure readers are going to want to know about now, and how you're starting to cover some of those topics.
Yeah, it's, we're not really a news organization, so we're not covering it like a lot of people are. People are coming to us because they run and they need that information. So the one article that we have it's our top performing article, has been for a little while now, is what do I need to know about coronavirus and can I still run? And it just answers those questions. Is it safe for me to run? What do I need to do? If I'm sick, should I run? All those. So helping people have those answers for things, but then just also giving them the tools they need. We're focusing on a lot of the training you can do inside the house, treadmill workouts, giving people reviews of treadmills, giving people reviews of shoes is a big thing. A lot of people are researching running shoes right now as they're coming back to it. So, we worked on the coronavirus stories very heavily at the start because it was new. And I think we're starting to see everybody is adapting to this new normal, and especially as it spreads across the country and other areas are affected by it more so than what we were in New York and up in Seattle. Other people are going to get affected by it, but then it's sort of, okay, what now? We're used to this now. How do I sort of get back to some sort of normal? Runners are very goal-oriented people. Our races are gone, but we still want to see results from whatever we're doing, right? So we have to think about that coverage. How do we help those runners stop thinking about the coronavirus problems? They've got all the info they need from us, at least in terms of what we're going to do. How do we help you meet your goals as a runner now moving forward?
Yeah. I mean, it's interesting because I think in a lot of ways, as I hear you talk, I think that we demarcate time by spring marathon season. And there's Thanksgiving and Christmas and Hanukkah and Passover. Those are all great. But for me, spring is a spring marathon, fall is a fall marathon. And I was trying to think, what month are we in now? And it's weird because without having, Brooklyn Half Marathon or Boston Marathon or New York Marathon or whatever race to demarcate time, and not having that really is very unsettling when running has been a big piece of how you kind of set your bearings.
Yeah, and it's tough. We are thinking about that from a coverage angle too. When do we start talking about training again? At some point we can still train for races even though we're by ourselves, right? I can still go out and do my regular runs and training runs, although the tracks might be closed and it might not be wise to do a long run necessarily. But what am I training for? Are the races that have been postponed or that are scheduled for later in the year, are those going to happen? We don't know. So luckily for us runners, we're going to run anyway, right? So you just keep a good level of fitness. And if the race is on, now it's time to start sharpening and, use whatever little bit of time we have when we finally get some sort of all clear to try to get in the best possible shape we can, knowing that we're probably not going to be in PR shape if, the fall marathon season does materialize.
Great. And I see a bunch of great questions that we'll get to, guys, at the end. And I see those, both medical questions for Jeff. I'm now going to bring on Brett Torres. If you're just joining us in the Zoom, if this is your first time to Zoom, you can swipe left or right to see all the speakers at once or just the person who is speaking. Brett is a fellow colleague, terrific guy. He's a sports medicine doc at Hospital for Special Surgery with me. He's also the research director at the Primary Care Sports Medicine Service and the head of our running medicine research group. Brett, we should be meeting, talking about studies for upcoming races and what gets runners hurt, not talking about this subject, but thank you so much for coming on.
Yeah, my pleasure. Yeah, wish we had a different topic to talk about, but.
I know. But I think for both of us, one of the things that I think is really important is that there's so much news and there's so much medical news because, usually people are used to their doctors and health providers having good, solid information to say, do this, don't do this, take this pill, don't take this pill, have this exposure, don't. And this is something which is not only a new virus that we've never seen, but we're struggling, I think, on the medical side of what's the right advice to give.
Yeah, exactly. I think people are becoming all too familiar with terms like N95s and droplet transmission and aerosols and things like that, which it would be best if we just leave that to the infectious disease specialists.
Absolutely. One thing that I'm doing a lot of is trying to sift through, the information on what I can do to keep our community healthy. I mean, you see the picture behind me is one of our fall mornings last fall in Central Park, that was the way to keep our community healthy. And now I'm kind of focused on what I consider to be the four legs of the table, kind of the mind, the body, nutrition, and community, and trying to figure out the right ways. But I think we're still struggling to figure out what's the right amount of all those things. And I don't know if you're having the same kind of feelings on your end.
Yeah, I think it's going to be interesting to see how people adapt. And this has definitely been a month of a lot of people experimenting with how they're going to be exercising and what they can do. For a while, it was a little bit of a moving target in terms of what the recommendations were for how you could exercise, how you could gather. If you could have initially just a small group of people gathering, if you had enough distance apart, so you could still do a small running club. But now the recommendations are starting to become more specific about exercising alone and outside only if it's something like running or biking. And a lot of people are not even having to have the option if it's safe to go to the gym. They just can't go to the gym because it's closed.
I mean, it's interesting when I was doing early interviews on this, and I thought, like an aggressive airborne illness, but strong flu, if you kept social distancing to the gym, it was probably okay to go to the gym. And then all of a sudden, it seemed like that was not the right advice. I mean, I think we're really trying to figure out the right bearings on this, and I think we will continue to be doing that for a while. So with that kind of concept of transmission of virus and of disease, Brett, what kind of, you obviously not only like I do, are doing a lot in patient care, but also looking at research studies all the time. Where can you hang your hat at this point? I've heard, transmission with kind of breathing or sneezing, or, some people are emailing me, it's on the bottom of your shoes. There's a lot of transmission, touching, not touching. What kind of comments can you make for everybody watching on that subject?
Yeah, so the main two ways that coronavirus is transmitted very clear is respiratory droplets, which mean if you cough or you sneeze, those are these larger fluid particles that get expelled. And if they come in contact with your eyes, your nose, your mouth, it can infect you. And so that's the whole basis for the 6 feet of social distancing, is that you should be, even if somebody does cough, you should be out of range for catching one of those respiratory droplets. The other thing that is clear is that there's contact transmission. So if somebody coughs or sneezes on a hard surface and you go behind them and touch that door handle or touch that countertop, and then you touch your eye or pick your nose or bite your nails, that could get you infected as well. There's a lot of debate, though, this week about airborne transmission, meaning if somebody just simply breathes in a room and then minutes, hours later, you walk into that room, could you be infected? And although there's some studies that look like they can detect a virus floating in the air, it looks like just based on what they're seeing of how the virus is being transmitted or who's getting infected with it. It seems like it's more of the close contact respiratory droplets, that contact transmission that makes up the vast majority of how people are catching it.
Yeah. We're getting a lot of questions, guys, and please write your questions. I'll try and get to some of those. A couple kind of things that are obviously longer answers, or could be, but just kind of quicker questions of protective gear. About 4 or 5 people, Ellie Hirschfeld, I saw, wrote, among others, mask, goggles, running in Central Park. You know, certainly seen some of that. What's your feeling on protective gear?
So right now, I think if you are in a situation where you need to have protective gear, you probably should just simply choose not to be in that situation. So respiratory droplets are the main reason why people wear surgical masks. And so these are the masks that are more of a rectangle, have a couple straps around them, and you can still see that they're not completely sealed off. Those type of masks simply prevent somebody from spreading respiratory droplets. So if you're sick and you're having any sort of symptoms, those are good if you're having to be in contact with somebody. But they're also a way that you can prevent being exposed to respiratory droplets. It also helps you keep from touching your nose, touching your mouth if you're wearing a mask. So that's another
that's fair.
benefit of it.
What about what about running in metro areas? So, you know, I have a number of people, and Allison wrote me from Virginia. She lives in rural Virginia, and she's not so worried because she does a lot of trail running, which she's happy to do. But then I have Jim, who just wrote me from Los Angeles, who said Los Angeles is a more crowded place and there's people around. And so what advice do you give people running in kind of urban metro areas versus kind of running out on the trail? Sounds like, you know, what I would say and what you would say is that the more isolation, the better. And if there's a lot of people, you got to maybe try and figure out a different place to run.
Yeah, that'd be my advice as well. That if the only option of a place to run is on a crowded sidewalk or somewhere where you can't keep enough space, I would recommend just simply not running in those situations as opposed to running with a mask, because the masks are not perfect. And we wouldn't recommend general public use the type of masks that are needed for the airborne transmission, which is the N95. So that's what a lot of times people were using simply for taking care of patients with tuberculosis or measles, but now it's being something that's used primarily in the ICUs when they're doing things like intubation or getting somebody hooked up to a ventilator, because that's where it can expose a lot of people to some of the smaller droplets that are not necessarily protected simply with a surgical mask.
That's right. And then finally, Brett, and then we'll get to Polly, you know, cold and flu symptoms. And again, my advice to runners, and I've written whole chapters and articles on, you know, I've got a little flu, a little cold, run through it. Like, I'm a big believer, if it's above the neck, you run through it. And if it's below the neck, you know, maybe time to back off a bit. But I'm giving different advice right now, both on those symptoms and on exercise intensity. And I was wondering if you can comment on both those things. What I'm telling people is that if you're getting, you know, some early cold flu symptoms, it's the time to really go for a walk and just back off and maybe do just a run walk, or really gentle. And I'm keeping my patients in the moderate zone of intensity, meaning not a hard workout, for the reasons of kind of encouraging immune function versus kind of bottoming out their interleukins, you know, 48 to 72 hours afterwards, and having them more susceptible to infection.
Yeah, so those are 2 points. So one is, how much can you stress your body when you are sick or recently recovered from being sick? And then 2 is, how much can you stress your body without putting yourself at increased risk of getting sick? So if we could just confirm that everybody who has a runny nose or a little bit of a cough has just a common cold, then yeah, you could use your same advice that you've been given for a while, is that a little bit of activity during that time probably can't hurt. The problem in this case is that because coronavirus is so prevalent, you really don't know if that's your common cold or if it's just the start of what could be a more severe illness with coronavirus. And so it's best not to stress your body if you're having any sort of symptoms these days. If you have had coronavirus and you're recovered, best also not to stress your body for probably a good week afterwards. They're saying you can come out of isolation after a few days, but even at that point, it's best to let your body have plenty of time to recover before you really go out for a run. And then the other thing you were
Being a
mentioning,
good body, yeah, yep, the intensity piece, yeah.
the intensity, yeah. So there's debate right now if overexerting yourself, going for a run longer than 60 minutes or at an intensity, some people just threw out numbers like 75% of what your max intensity would be, that could potentially in the short term weaken your immune system, so to speak, and make you more susceptible to an illness. And right now there's people on both sides of that argument. So I think when we're left without clear guidance, I think it's always best in a situation like this to err on the side of caution and to not push it beyond a 60-minute run or a really intense run. Yeah,
I think that's exactly right. Brett, thanks so much. I'll get back to you during the Q&A. And guys, keep writing your questions. Loving seeing them. Now I'm going to pull down a good friend, longtime, terrific colleague at Hospital for Special Surgery, Polly DeMille. Polly is the director of our Tisch Performance Center. She has a number of different titles, including initially as a nurse, then as a strength and conditioning coach, then as an exercise physiologist. Now she directs all of our performance programs. And she's been a terrific resource for a number of years. And Polly, thank you so much for coming on tonight.
My pleasure.
And I think she's got the best background of any of us, I have to say. That thing looks awesome. So you win the background more. So Polly, people in listening to this, I want them to think about moderation of exercise, which again is something which you've known me for a lot of years, and you see me up at Lake Placid and Ironman, and moderate exercise and what I love to do are not, they're not really in the same sentence. But I've really tried to back off intensity, really strong intensity, because I know that after doing a marathon, I often get sick for 3-4 days afterwards. I almost always get that post-marathon sniffle, and I want to do everything I can to keep my immune function maxed. So if we're going to suppose for the moment, though we don't know for sure, that kind of a moderate level of exercise is what we're going for, how can people kind of figure out how to moderate their exercise, both duration and intensity, so they're kind of in a zone which is healthy and getting them some benefit, but not unhealthy, meaning kind of putting them into an unhealthy place?
Well, I think some people already kind of know their zones. They've got them sort of dialed in, their heart rate zones or their paces. So some people are already pretty familiar with sort of what their easy aerobic pace is, or a tempo pace. Otherwise, I mean, you can use rating of perceived exertion, but just think about some pace in which you could have a conversation with somebody when you're running when you used to be able to run with your friends, if you were talking and laughing, that kind of pace. Where you're breathing hard, you're sweating, but you're basically comfortable, and then taking it up to a pace that, maybe you would rather not talk, but you could. The other thing to think about is when you finish your run, are you feeling trashed or energized? And that's, running should really be restorative and sort of a source of sustenance for us now. And, stress is cumulative. So we're under, all of us, a lot of stress right now. And so sometimes moderate run is a little more stress than your system can take. So you just want to sort of notice that as well. Like, how are you responding to the run, regardless of how hard it was? Do you come back feeling like $1,000,000, or you feel kind of like, oh my God, I got to take a nap now? And that's also sort of telling you how you're tolerating it.
It's interesting. We're doing for everybody watching, is we're doing Tuesday nights our running medicine webinar. And then Thursday nights, we're doing a general wellness webinar. Our topic next week is, by the way, going to be the psychology of perseverance. And we're going to talk to people who have had kind of overcome obstacles in different ways. But on our Thursday webinar last week, we had some folks on talking about inflammation as a not generalized inflammation, and studies that have looked at inflammation impeding healing of wounds, and people have looked at inflammatory response. And so it kind of makes me think about kind of maximizing this immune function and not putting ourselves into a place where we're doing damage. I think it's all part of this inflammatory cascade of keeping people in a healthy range of exercise. I think it's important.
Absolutely.
So Polly, the other question that we're getting a lot of, and please write in your questions and we'll get to as many of them as we can, everybody, as we're going along, is supplementing fitness. So many of the people that we deal with are exercise enthusiasts, And if you live in New York, most people live in a space which is smaller than places, everywhere else. And so how do they really think about keeping themselves as fit? Because many of our patients, think of themselves, they feel losing fitness. So how can we make sure they're in a healthy zone in terms of maintaining fitness?
Well, I think now is actually a good time to make yourself a better runner. I think your running performance is not just your cardiovascular fitness. It's the sum total of your flexibility and your joint range of motion and your strength and your balance, your single leg stability and your core strength. And I think runners often would rather be running than doing all that kind of stuff. So it's actually a good time to really make yourself bulletproof from injury when you get back to being able to run as you want to. I think I could speak for both you and Dr. Torres that there's no such thing as too strong a pair of glutes in a runner. And your offices might be a lot more empty if people did a lot more core and hip strengthening. So I think, you're at home, you don't need a ton of equipment. You can do your bridges and planks and, RDLs and single leg squats and monster walks and all the stuff that's going to make you a better runner, do foam rolling, all the things that you kind of neglect when you have a busy life and you want to get your mileage in. It's a great time to kind of allow yourself that time to take care of those things, that when you do get back to running, you'll be even better than you were before.
I think it's a great suggestion for people to start thinking about. Are there any resources? I know at the Performance Center, I know you guys are streaming classes internally. Are those available to the community, or are those just for internal at HSS?
Right now, they're just internal for HSS, but we're probably working towards something that will be more up on the HSS website.
Yeah, I think that's important. I think that's really important, and I think that's great advice in terms of thinking about that. And then finally, tell us about your experience. So I've been doing telemedicine now for a couple of weeks. I know Brett has as well. A number of our colleagues in our sports medicine group, as well as most of the orthopedists and rheumatologists are doing now televisits, meaning meeting patients like this. Mm-hmm. And I think you guys are now doing telephysical therapy and teletraining eventually. What have you found from kind of this virtual world where you got this perfect background? Somebody, in some ways, I found it's frustrating because you can't reach out and shake the person's hand, but in some ways it's really great, and I think it's something that's going to be with us going forward. I wonder what your experiences are.
Yeah, we just started actually. So we just telehealth for us just started up. So I have people that I've been training for ages, and they're not just clients, they're friends, and we've been emailing each other and making sure that they're doing what they should be as far as exercise. But I think to your point, a lot of them aren't able to do what they used to do. They're not able to get outside. They're not able to follow the usual training routine. So a lot of it has just been kind of guiding them on what they can do at home, changing their exercise routines up a little bit. And it's better than nothing. You do get to see each other. I can still watch their form. I can still, suggest things, looking at what they have in their apartment to use. So it works. And I think you're right. I think it will become a bigger part of how we all interact and in the future.
I think so. So if you're watching us now, you can swipe your screen to the right or left, and you can pull in the view so you have all four people at once. Or if you're on a laptop or a desktop, you can click on the upper right-hand corner so you'll see everybody, and all three of your mics are unmuted, so you should all pop up. And I'm going to ask some questions here. We have Leah Gallagher. Leah is from Inwood, and Leah says, I stopped taking the subway and the bus, and I started riding a bike to work. I've stopped running for the time being. Does riding a bike replace running very well? And I'm just wondering, I love running fitness, and riding a bike's okay. Can I keep my fitness by riding my bike? That's Leah's question to you, Polly.
Absolutely. I mean, you can, training is obviously very specific. So riding a bike is not as much obviously pounding. You're not, the muscle fibers are adapting specifically to what you do. But your aerobic fitness, sure, if you're doing intervals on a bike or riding up a hill, you're going to get your heart rate up. You're going to, stimulate your aerobic system. So yeah, you can maintain fitness. It won't be running specific fitness, but you'll still have cardiovascular fitness.
Here's a great question from Rob Roth. Rob is an Iron Strength devotee from out in Indiana. He and his son do it all the time and send me great pictures. So great job, Rob. So Rob asked the question, Jeff, this is for you. Half marathon has become a virtual race. Do you still train as if you're going to do the event and try and PR, or just run it as a nice long run? What do you think, Jeff?
I don't continue training and trying to race it right now. I mean, I think if you're fit and you want to give it a rip, it's a half marathon. It might not be so bad, but as you said earlier, you wear yourself down. We tend to get sick after hard efforts and long races, and that's the last thing you want to be doing right now. It's also, you're kind of doing it on your own. It's really hard to push on your own, and it's not quite the same experience as if you're racing other people. So it's an individual decision, really. If you want to take that chance and go after it, sure. But as Polly said too, this time now is really one of those to sort of reflect and, work on yourself and build a strong runner. Races will be around again later. We'll be able to get back after it. So I personally,
it's amazing. Yeah.
To be racing.
Yeah. It's amazing how things you just kind of took for granted are now, on hold, and you really miss it. So I think that's exactly right. That's good advice, Jeff. Brett, here's a question from Scott Wallard, who is a great runner in New York and a chili chef who usually comes in second place in our chili competition. It's not his fault. So Scott's question is about wearing a surgical mask. His wife works at Cornell, and he has been running in a surgical mask in Cornell, and he's not very comfortable doing that. So I want you to talk to Scott about, does he actually need that surgical mask in Central Park?
Good question. So you definitely are starting to see more of them in Central Park this week. That was something that was pretty rare to see a few weeks ago, and now it's becoming more commonplace. A surgical mask is really going to just help you with those respiratory droplets to protect them from reaching your mouth or your nose. So if you are able to keep distance from other runners, so if you are wise about picking times of day that are not busy, you're venturing out into the bike lanes or into the car lane in Central Park where runners are usually not congregating, then you probably have no need for a mask at that point. I would say if it is getting crowded enough that you aren't able to keep that distance, again, rather than wearing a mask and trying to do your best like that, I would just say don't run during those times, and instead go wake up early the next morning or go for a late evening run or something like that when there are less runners, so you really are able to keep that 6 feet distance and you won't have to use a mask.
Tons of shout outs for Polly here on the Q&A thread, just Pam Geisel and a bunch of others saying great job, Polly. So I'd love to see that. Carl, here's a question from Carl Harold, who asks, in terms of adjusting his training plan, I'm signed up for a Brooklyn Half Marathon. Should I stick to that plan or reduce the long runs and just keep a maintenance fitness, assuming it might not happen this year? My advice, and I'll see, all you guys what you say, but I think for the moment, I've really shifted myself to getting outside. I try and get outside if I can twice a day for a little bit in the morning and a little bit in the afternoon. I keep my intensive, after work, before dinner, and I just do short little periods of outside fresh air, really low intensity. And I really do believe in the benefit of fresh air. Interestingly, where I did my internship up in Boston was a place called the Boston Floating Hospital, which was actually founded just around the time of the initial flu pandemic, and it was actually built on a ship that went out and sailed in Boston Harbor because they recognized that it was healthier for the kids to be in fresh air. And so I really do believe there's been some stuff the New York Times has been putting out about distancing and fresh air. So I go kind of easy just a couple times a day. But I'm wondering for you guys, what would you say first, Brett, then Jeff, then Polly, to Carl, who is training for Brooklyn Half? Does he just assume it's not going to happen and just do maintenance, or do you have him recommend staying on his program? So Brett, then Jeff, then Polly.
So I don't have any inside knowledge in terms of what's happening with the Brooklyn Half. I'm registered for it myself. And in terms of what I'm doing for training, it's really, I'm maxing out at about an hour of running. And so however much you're able to fit into that amount, I think is reasonable. I think I would be surprised personally if Brooklyn ends up happening, just because that's coming up pretty quick. And I don't think life's going to necessarily return to normal as soon as we pass the peak in a couple weeks. So I think we're going to be dealing with social distancing for a while, even into the summer or fall. And so I think big races are probably not going to happen, especially in a place like New York City that's being hit hard by coronavirus. So I think training for a half marathon, like Jeff was saying, you could probably do an easy 13 miles or something like that for a virtual run. This wouldn't be the time to try to get a PR. But I think if you, like a lot of us, are feeling like it's less likely going to happen. I think it's reasonable to start to cap your training, your long runs at about an hour or so.
Great, Jeff?
Yeah, that's exactly right. I think you could train hoping that it's going to happen. Your race hasn't been canceled yet. You haven't been disappointed yet. So you can continue training thinking you're going to be able to race that. But I wouldn't be going super long. Luckily, it's a half marathon and you're not doing the same volume you might for a marathon. So keeping under that hour benchmark, you can get most of the training you might otherwise do for a half marathon anyways. Your long runs might get tempered down a little bit, but that's okay. For a half marathon, you can kind of cheat your way through it on race day too. It doesn't hurt as bad when you show up undertrained for a half marathon as it does if you do that for a marathon. So you might be able to get away with it. But again, it's not a PR day. You got too many factors have been thrown in your way.
Polly, I'm going to give you a question from Elizabeth, which is along these same lines. Elizabeth Benson asked the question, hi, I regularly run a longer run, 10 plus miles once a week. Is it okay to continue to do that now if I do it at a slightly lower intensity? Thanks so much.
Yeah, I think, if it feels like you feel great afterwards and you're comfortable, that's, about an hour of running. I mean, I think right now for all of us, we all have our goals for whatever races or accomplishments we have had in mind before this happened. But really for me and from the clients I train, our real primary goal right now is to stay healthy. And insofar as everything you do is aimed at that, getting yourself stronger, getting your immune system at the best it can be. And so exercise certainly is a component of staying healthy and keeping your immune system strong. And you have control over certain things. You can do stuff in your apartment and strength train and stretch. So the goal is really to come out of this healthy and stronger than we were before and ready to hit those other goals and accomplishments.
You bet. Allison Ortidi, thanks for the nice comments. And Stephanie Victor, thank you. So Stephanie Victor is a diabetic, a type 1 diabetic who uses running to kind of modify her insulin and insulin dosage. And that's a big part of her care, as she says. And so Polly, just kind of some advice for her on continuing her running program. Sounds like she can do it as long as she sticks by the guidelines we're talking about. Does that sound reasonable?
Yeah, absolutely. It sounds like a reasonable plan, because again, we want to stay healthy and exercise is such an important part of maintaining your health. So I certainly encourage people to find a way to do it.
I think that's important. I mean, I think it's one of the reasons why, I think all of us have been so interested in having these discussions and getting out and doing, because this coronavirus it's scary for the it's scary for the population, it's scary for the medical staff, it's scary for everybody, it's scary for the politicians, it's really scary for everybody. So it would be dishonest to say it's not. That being said, we don't want to sacrifice general health for this. So I think it's really important to keep yourself as healthy as you possibly can be. I think that's why we're trying to do all these different things to give outreach to the community, because people can just feel isolated and afraid, and that's not healthy for anybody. Brett, here's a question for Patricia, who is training for the Lake Placid Ironman, one of my all-time favorite races. So she's wondering about taking down her training load and if that's going to affect her for the Ironman. Based on your comments earlier, I mean, we're not calling anything yet. And certainly one of the good things and bad things about triathlon training is that triathletes tend to be individual athletes. And so she can do some of the things she's still doing, running and biking, but she's not going to be doing them in a group. But you're not super optimistic about, big mass population races in the short term. Is that fair to say?
Yeah, I would be surprised to see big races happen. Lake Placid Ironman's definitely different than the New York City Marathon, where you have 50,000 people. But I think we're going to be in a year of just a lot of things being put on hold or pushed off until next year. So again, like Jeff was saying, that the race hasn't been canceled, so you might as well keep going with it if it's something that you're not wanting to give up on at this point. But it is, you just have to reframe your perspective on your goals for what you can do, and just know that if it ends up happening, there's going to be a lot of people at the start line who are underprepared, and you're not going to be alone if you didn't keep up with your training volume, because that's going to be what everybody's doing. Nobody's able to do a great training these days.
Fair enough. Emily Krause with a nice comment from Stanford out in California. Thank you very much. Maria Maddox asked the question about taking days off. And do you recommend taking days off or not? And it's interesting because I would say that normally, you know, I do something every day personally, but I certainly do very different things. And sometimes it's a little bit of a nothing or a little yoga or a little stretching or whatever, but I try and really vary what I do. But I try and do a little bit of something every day. I think the risk here is that, you know, kind of grinding yourself into the ground, causing an injury, and then you can't do the things we're talking about to keep yourself healthy. I'm wondering, Brett, are you giving any different advice on days off for people?
I'm trying to encourage people to keep up what they were doing before. So this isn't the time to try to increase your mileage or increase your frequency or pace. Just trying to maintain the status quo for a lot of folks is going to be a good plan. So if for whatever reasons, if just your routine or your mental health depends on getting out for a short run every day, I don't think that's necessarily a bad idea. But I do think that if you now have lots of time on your hands because you're not working, I don't think what you should do is now pick up running 7 days a week because you haven't done that before. We don't want you to be out there with a stress fracture and then get infected if you have to try to come into the hospital to get seen by a doctor.
You bet. Carolyn Ho asked the question about routines to supplement your exercise with. We'll email out some suggestions of different routines and things you can do and ways you can strength train and just do fitness at home at the end. So happy to do that. Anonymous attendee asks, any suggestions to curb anxious eating of carbs? And it's interesting because runners eat a lot of carbs, right? They do because they need the fuel and it's easy fuel. But a combination of, you know, anxiety and being around a lot of food. I mean, I think those are all real things. Jeff, is that something you guys have talked about or thought about in terms of kind of having plentiful carb sources around and maybe not as many avenues to get rid of them?
Yeah, you know, that goes to a lot of the aspects. We're stuck at home, but we can't just let our schedules go to crap, right? Like if we're working, we still need to get up at the same time and put on pants and actually carve out the hours that we're going to work and take our lunch break and really protect our work and our lifetimes. And scheduling in that, we should also schedule in our eating like what we did before when we were going out to work. You know, what were we going to have? Now you don't want to just sit there and snack. Actually be mindful of what you're doing and just make sure that you're protecting your schedule and your activities just as you had before. Just because we're stuck to our house, stuck inside our house, doesn't mean that all the rules, you know, go out the window and it's just anarchy.
Right. And then I guess I'm going to finish. Here's Kristi Johnson with a really good question, Kristi. And I think we'll finish, and I'm gonna give this to the three of you guys. And Polly, you'll take it first. Then we'll go to Brett. Then we'll go to Jeff. And her question is, hello, I'd like to know if it's ethical to run in New York City right now, as long as you run solo. I'm showing no symptoms and keep my distance from others. I find running is the best way to manage my anxiety right now. If so, on the days I run, should I make that the only time out of my house? And again, I started with this, you know, kind of concept that this is such a strange time. The title of our webinar is, you know, basically running and running medicine in this new world. And this weekly look inside our new world is something we're going to be looking at because it's a very different set of affairs. So Polly, then Brett, then Jeff, just kind of comments on is running the only time I'm outside my house?
Well, that's a great question, but I mean, certainly the message that we've been getting is to minimize the time outside. I think, you know, if you're running and you're keeping your distance from other people's and you're running by yourself, there's nothing unethical about that. If you're going out, you know, and sort of being in contact with other people, that's a whole different story. But I think, yeah, it's like incumbent on all of us to listen to what the message is to try to really minimize your time around other people. So if you live in, you know, if you're up in Vermont and you live in a place where there's no one around, you can go outside all you want. But if you're in New York City, you have to be a little more selective about when you go and where you go. But I think you can find times to do it without endangering yourself or others. It doesn't have to just be once a day if you pick the right time and place.
I would agree with that.
Brett?
So
Good.
we've talked a lot
Yep.
about if you go outside, how to keep yourself healthy, but we haven't talked so much about what kind of risk that puts the community at or the people at home at if you come home after catching something. So if you are younger and otherwise healthy, you have a good chance of not having a severe illness with this, but there are people hospitalized who have no risk factors. But if you are out there and you may not have a lot of symptoms, but still may have the infection and able to spread that to others, or you are early on in the course of the infection, so you haven't yet developed symptoms, it's important that you're being a good citizen and not being too close to other people or doing unnecessary trips outside. I would say though that solitary activities like running, especially when you're being good about when you pick your times and keeping your distance, I think you're not putting anyone else at risk. So I think that's a good thing to keep doing.
Jeff, I mean, we're used to seeing all these great covers on Runner's World of, you know, kind of groups and people in big groups smiling, and it really is a new world. That's why I wanted you on this tonight, because it feels like a new frontier. I don't know how, I'll give you the last comments on that.
Yeah, you know, the thing we've been doing, I get the question all the time. I actually was invited the last couple of days to run with people, and I said no, and they're like, well, but it's just one person, and we'll keep our 6 feet, whatever. And our Runner's World's message is no, run alone. Don't meet up with your buddies. Don't try to keep a 6 foot distance. You know, we're staying home. We're making all these sacrifices. As runners, we're in pretty good shape, right? We're fit. We're probably going to have a pretty not real complicated situation generally.
We hope so.
Time to be healthy, right? Yeah, we hope. I mean, but I'm not staying home necessarily for my own health. It's for the greater good of everybody, right? Slowing that spread, taking the stress off the medical system, not putting the people that are at higher risk levels, you know, in danger. And by being selfish and trying to go out and run in a group or run with other people, you're not doing your part then. So run alone. It's going to be maybe another month, maybe a little bit longer till we can start thinking about joining up with one person again.
Mm-hmm.
You know, we'll see how that goes, but okay. So just, it's not that big a deal. You know, the loneliness of the long distance runner is sort of that, you know, it's happened through history. We pound these miles by ourselves. We're up in the dark running. We can do this. We can, and then we can use these tools like what we're doing right now to tap in, see how our buddies did, check in on Strava and see what they did. We're not really alone. We're just separated right now. So we can.
It's interesting. Yeah, it's interesting. As I kind of finished, I was listening to an interview with the medical internist in chief at Mass General in Boston, and he said he really preferred the term physical distancing rather than social distancing, meaning you're physically apart but you're socially together. And I think it's a good way to finish this. So first of all, to all of our panelists, to Brett, to Jeff, to Polly, thank you so much for being here and sitting on this discussion. It's sobering but also really helpful and I think powerful to talk with like-minded folks. So thank you, 3 of you, so much for being part of this discussion. Next week on this Running Medicine webinar, a weekly look inside our new world, we are going to talk about psychological issues of overcoming psychological barriers and psychological toughness. There's obviously a strong psychology to this whole discussion, and we're going to get into some of that and talk to some people who've overcome some real obstacles in their lives. I think that'll be very powerful. And then on Thursday, this Thursday, and every Thursday, we're running really a wellness webinar. This Thursday, we're going to start with Leanne and Scott Dispenza, who are 2 patients and singers at the Metropolitan Opera, and they're going to sing an aria just for all of our people, just for some solidarity. So we look forward to seeing you all there. You'll get tomorrow evening the sign up for next week's webinar on running and for Thursday evening's webinar. And I just want you to know that we're thinking about all of you. Thank you, panelists, for joining us, and we look forward to seeing you very soon. We are thinking about everybody. Hang in there.